Have you seen some middle-aged individuals with amputated limbs? They are using crutches. It's most likely a complication of diabetes. Yes. In fact, diabetes is one of the leading causes of limb amputation, renal failure, that's kidney failure, heart failure, and even blindness. In fact, it's one of the leading causes of death worldwide. Some research placed it at number 7 leading cause of death worldwide. But diabetes is not a death sentence. Do you understand that now? It's not a death sentence. In fact, if it's well managed, you can live almost a normal life. Okay, that's why it's very important that we discuss it today. By the way, I'm Dr. Sai, a medical doctor and the principal tutor of Dr. Sai Physiology Academy, DOPA for short. Welcome to the Patonic, where we democratize medical knowledge, making it easy even for a 10-year-old to understand, so you can take better charge of your body and health. Now let's get started. So the number 1 must-know fact about diabetes, in full, it is called diabetes mellitus. Okay, so we can shorten it DM. So at what point do we say someone has diabetes mellitus or DM? Okay, so first of all, diabetes is characterized by hyperglycemia, meaning high blood sugar, which is as a result of deficiency of insulin. Sometimes we want to be very exact, we say absolute or relative deficiency. We'll talk about that. We'll understand that statement later. So it's as a result of deficiency of insulin that now makes, because insulin is involved in the control of the levels of glucose in your bloodstream. Okay, so when there's deficiency of it, goes very high, right? So that is diabetes for you. So at what point do you say this person is diabetic? Now use a glucometer to measure. It's something very easy. In fact, you should, as an adult, you should have it in your home. Okay, a glucometer, you measure the blood glucose. So the normal is around 70 to 100, but usually 70 to 90, average of around 80 something. If your insulin is functioning very well, if your pancreas where the insulin is produced from is functioning very well, usually it should be around 70 something, 80 something. Okay, 90 something is okay. So that's the normal. Then diabetes is confirmed if you do a fasting blood sugar and you get 126 and above, 126 milligrams per day. That's how it's measured. That's the unit. 126 milligrams fasting blood sugar. And what is fasting blood sugar? It means that you've not eaten throughout the night for up to 8 to 10 hours, and then you measure it. Okay, that's the first thing you do. Not that you eat at 8 p.m. and then you wait till 10, 11 a.m. and by the time you've moved up and down, done house chores, and you now say it's me, oh, because I've not eaten. No, that's not fasting. You've spoiled everything. Because as you are walking, exercising your body, the body is now trying to release glucose into the bloodstream for energy, so it will distort the result. So very early, 6 a.m., 7 a.m., before you start getting busy, immediately you measure it. That's fasting blood sugar, FBS. Once it's up to 126, that is confirmed frank diabetes. Do you understand that now? Then when you do random, that's any time of the day, and it's up to 200 milligrams per day, that is also confirmed diabetes. Nothing should ever make anybody's blood sugar reach 200, even if you just ate 1 hour ago. If your pancreas is functioning well, enough insulin, it should never reach 200. Do you understand that now? So that's the first must-know fact. So the second one is that there are 2 major types of diabetes, type 1 and type 2. So type 1 is the absolute. So type 1 diabetes is actually, it affects just 5 to 10% of individuals with diabetes, and usually younger people, as a result of autoimmune disorder. So your own immune cells are supposed to be fighting infectious disease organisms, foreign organisms. They are now fighting your own cells, the cells that produce insulin in your pancreas. You are now going there to fight and destroy them, and then insulin is totally absent. That's type 1. It's an auto, we call it auto, that's self, it's fighting against itself. Autoimmune disease. So that's what causes that one. It usually occurs earlier, okay, younger age group, teenagers, early 20s and so on. Type 1 diabetes. Then the type 2, which is more common, about 90 to 95% of people with diabetes, they are type 2, usually affecting older people from usually 30s, 40s, but sometimes you can see maybe late 20s. Okay, so type 2 diabetes is far more common. And how does that happen? It happens as a result of relative deficiency, in the sense that insulin can be produced in normal quantity, but your body is resistant to insulin. Insulin resistance. That means you are not responding to the insulin. So the blood sugar will also be raised because it's not responding to it. That's why I would say relative deficiency. Okay, that's type 2 diabetes, and it usually affects older people, and it's far more common. Do you understand that now? So if you've enjoyed this content so far, kindly click the like button and also the subscribe button, and don't forget to turn on notifications so I don't get to miss any new content that we drop. We're going to be dropping content like this every weekend, so share the video so it can also benefit others. Then the third must know fact, this is very important, pay close attention. There's always a misconception about this. Eating too much sugar is not a cause of diabetes. Now you're going to ask yourself, why now? Thought eating sugar will make you fat and so on again. Eating too much sugar is not a cause of diabetes. A lot of people, you see that you're eating sugar, diabetes is a lie. It has no relationship with diabetes directly. Look at what happens when you are eating too much sugary foods, and it's now making you to grow fat and obese. Then it now places you at risk of being diabetic, because obesity is one of the risk factors. We'll get into that. Do you understand that? But you can be drinking Coke, eating sweet things, eating sugar, and you are not getting fat. Okay, it's not making you grow fat. It will not place you at risk at all. So eating sugary things does not cause diabetes. It's only when it makes you grow excessively fat and overweight and obese that it becomes a problem. So the sugary food in itself does not cause diabetes. Very important to note. So the number 4 must know fact. It's about the risk factors. What are the things that make you more susceptible and predispose you to having diabetes? Number 1 is the obesity we've talked about. Obesity is a very, very high risk factor, but it doesn't mean that it causes it. You can have people that are obese and they never become diabetic. And you can have people that are slim and they have type 2 diabetes. It happens, but it's just a risk. Okay, a lot of people that are very fat, it places them at high risk of developing type 2 diabetes. Their body begins to resist the effect of insulin. Another thing, family history, that's genetics. Okay, another one, race, which is also related to genetics. It's more common in blacks, Asians, Latinos and all of that than Caucasians. Caucasians have more of type 1 than blacks. Do you understand that now? So these are the risk factors. Hypertension too is also a risk factor for developing diabetes. Do you understand that? So these are the 4 must know facts. Very important for you to know them. So subsequently, we're going to be dealing with more things about diabetes. All right. So I'm going to see you in the next video.